Good evening, everyone. Thanks so much for taking some time out of your week to come learn about some opportunities in Army medicine. Throughout tonight's presentation, if you have questions, please submit them in the questions box on the right side of your screen. We will have a Q&A session after the presentation. Tonight, we have with us Dr. Thomas Husted. Dr. Husted is a lieutenant colonel in the U.S. Army. He earned his Bachelor of Science from the U.S. Military Academy at West Point in 1993. He earned his MD from Case Western Reserve University School of Medicine in 1997. Dr. Husted completed his residency in family medicine at DeWitt Army Community Hospital, where he served as the chief resident his third year of training and was selected as most outstanding resident at graduation in June 2000. Dr. Husted has held a range of clinical, leadership, academic, and operational positions in the Army Medical Command. From 2000 to 2003, he served as the 101st Aviation Brigade Flight Surgeon, where he deployed with them to Iraq, earning the Spurgeon Neal Army Flight Surgeon of the Year award for his efforts. From 2003 to 2006, he served as teaching faculty for family physician residents at Tripler Army Medical Center's Family Medicine Residency Program and served as officer in charge of running the outpatient family medicine clinic. He was awarded the Family Medicine Outstanding Teaching Staff of the Year in 2004. From 2006 to 2009, Dr. Husted was assigned to the United States Military Academy as the United States Corps of Cadet Surgeon, serving as the staff surgeon to the leadership of the Academy. After the completion of this tour, he returned to Tripler Army Medicine Center, serving as department chair for the Department of Family Medicine, responsible for the graduate medical education family medicine residency, as well as the outpatient clinics and full range of inpatient services offered by the department. He arrived at the Medical Recruiting Brigade in August of 2013. Joining him tonight is Sergeant Major Daniel Murphy. Dr. Husted, Sergeant Major Murphy, thanks so much for joining us tonight. From here, we'll turn things over to you.
What it means to be a soldier and what it means to be a physician in the Army is the incredible patient population that Army physicians and healthcare professionals in Army medicine have the opportunity to take care of. Soldiers, their family members, and retirees, men and women who have raised their right hand and made the commitment to serve. Many of them have made the commitment to serve during a time of war, and some have, as we all know, have paid some very dear sacrifices. Those are the patients that Dr. Husted and his hundreds of peers in Army medicine have the opportunity to take care of. I think that's important. One thing that I like to highlight on myself, I've been in the Army for 20 years, and when I joined, one thing that was important to me was the fact that the Army was a values-based organization. On the screen there are 7 Army values: loyalty, duty, respect, self-service, honor, integrity, and personal courage. And these are not only individual values, but these are values, organizational values as well, values that guide our leaders in terms of decision-making and from the youngest soldier who goes to basic training, they learn these values. And again, these are the physicians who are serving in the military. So if you choose to take advantage of this scholarship, these would be your colleagues, people who commit themselves to these values, and these are your patients as well. I think the service to the nation and community is kind of self-explanatory in terms of military service. And then also, many people are interested to learn the soldier's creed, and I have it on the screen here. What I like to highlight are the four lines in the middle that are highlighted in yellow. These are what we call our warrior ethos. And again, from the highest four-star general in the Army to the youngest private who joined basic training, who went to basic training yesterday, each soldier learns and lives by these ethos. I will always place the mission first. I will never accept defeat. I will never quit, and I will never leave a fallen comrade. To me, this is huge. It's huge considering the men and women I've served with over the past 20 years. And then from the perspective of a physician, the fact that this is who you're caring for, men and women who have made this commitment. And oh, by the way, you've made this commitment yourself. So again, as we talk about what it means to be in the Army, it's fairly easy to transition into what it means to be in Army medicine. The Army Medical Department is one of the largest health networks in the world, and when you consider the entire military health system as well as the VA, it is the largest health network in the world. You have our budget and the number of beneficiaries on the screen. And what many people are interested to find, and you'll hear this in Dr. Husted's story, is that Army medicine is not just combat medicine. Actually, a very small percentage of Army medicine is combat medicine. There's more than 1 million soldiers between active duty and reserve who are serving their country today, and only a very small number of them are deployed to Afghanistan or in a combat environment. The remaining of them are on installations within the United States and Korea and Germany, Italy as well. And at each of those installations, those service members have their families, and it's Army physicians who are taking care of them. So again, we're much more than just combat medicine. We are very world-renowned in terms of research and development. Many Army physicians have the opportunity to go on humanitarian missions and work with advanced technologies that are not present in civilian medicine. On this screen are some of our larger Army hospitals, and you see the numbers on the side. One thing that's unique to Army medicine is the opportunity to practice in a very wide array of practice settings, from our smallest community clinics to medium-sized community hospitals to our large 8 medical centers. I'm sure many people are familiar with Walter Reed. We also have large facilities in Hawaii, Seattle, San Antonio, and Germany, countless places across the United States. Walking into one of these facilities, it's the same as walking into a hospital. Dr. Husted and I were in Johns Hopkins today up in Baltimore. The same feel. Hospitals are hospitals. Dr. Husted always says patients are patients and doctors are doctors, whether that doctor is in the Army or works for Johns Hopkins. Portrayed on the screen are our installations nationwide, as well as our installations in Germany, Korea, or pardon me, in Europe and the Pacific. On this screen, we talk about research, and as we conduct these presentations and as we talk to med students and residents nationwide, we find more and more young physicians are interested in research. And as I mentioned earlier, many don't recognize that there are countless opportunities to conduct research within the Army. We do have 7 research labs globally, and one thing that I was interested to find as I did my own background information on this was that the Army is recognized as one of the top 100 global innovators in terms of inventions, patents, and submissions into peer-reviewed journals. So with that being said, we've kind of given an overview of what it means to be a soldier, what Army medicine, the Army Medical Department is all about, and I'll now pass this off to Dr. Husted to kind of hear his personal Army story.
Thanks, Sergeant Major. So again, as I go around and talk about this scholarship program, my career has been a clinical career, and I've just spent the last few months, about eight or so months, working with our recruiters to be able to share a story that's so important to me, and I feel very passionate about it, that we attract the right kind of physician or future physician who wants to be taking care of the heroes that Sergeant Major talked about, and working in the environment that I will share with you, because it's not for everybody, but it is for some, and it's for those that really want to be challenged to do neat and exciting things, and do kind of that extra call of service. We're all as a physician, you're usually altruistic and want to do things for and serve people, but what a different level you get to do when you do it at a level where you take care of the soldiers. And in this slide, I just write the word heroes because the person standing next to me, that's me on the right, and the person standing next to me is one of the soldiers I was with when I was deployed to Afghanistan in 2010. That was my 40th birthday, and I was in the middle of nowhere, but yet I couldn't have been more proud to be with that soldier and who he represents. And he represents the thousands of soldiers that I've had the opportunity to care for, whether it was deployed or for the 90+% of my career back in American facilities, Army facilities. And what I have found is that the American soldier is really, truly amazing. And I am constantly in awe by what they do. And I saw that day in and day out, them do missions where they were really willing to put their lives on the line to protect our freedoms because our country asked them to do that. And so, to me, that's first and foremost. We need, because of that and what they're asked to do, we need great doctors. We need clinically competent, excellent, excellent physicians who will take care of these men and women when they get injured, and will do a great job taking care of them because they deserve no less. And so it's real important to me that we understand who we're serving when we decide and think about a scholarship in the Army. And then the next couple of slides really focus on reasons why I have stayed in the Army. I love taking care of these soldiers, but what I have found is really a couple extra truly added bonuses have been the people that I get to work with. And in this slide, you'll see some pictures of some physicians at a banquet with our wives. I'm the second one in from the left, and just those guys that I'm with, they are some of the best doctors you'll ever meet. Truly world-renowned in some of their studies that they've done in different research and the things that they've published. But more important to me, they're just phenomenal characters, and they really represent those Army values that Sergeant Major had in the beginning of the slide deck. And they're people that when I woke up in the morning, I was excited to go to work, knowing that I was going to be able to work with them. And sometimes medicine can be tough and it can be a grind, but when you know you're working with great people and you're excited about who you're working with, and you serve a population base, and it's not just the soldiers that you take care of, it's their family members and retirees and veterans, so you serve a whole population from the youngest to the oldest in all disease processes. But when you're doing it with these kind of quality individuals, it just makes a difference. It makes you excited to get up and go to work every day. And then the other thing that I'll talk about is the opportunities that you have to do different things in the Army. And this slide just represents some of the opportunities that we get asked a lot of questions from females. What opportunities do I have as a female? Can I be, a female and still be in the Army and do Army medicine? And I've got a number of colleagues who have had great successful careers doing a bunch of different things, who have be able to have families and be able to balance being a mother, being a physician, being a wife or husband as well, for those spouses, because the husbands still have the family responsibilities and their opportunities are the same. But the biggest question for women is, does the Army, make me have to not have a baby because I'm going to deploy or whatever? That's never the case, and those opportunities are there for you. And some will even tell you that it's a better support system because the Army will pay you while you don't have to worry about maternity leave. It's guaranteed, and you've got people taking care of your patient population. You've got colleagues that you work with that you have great camaraderie with, as I mentioned in the previous slide, who's helping you through that process as well. And they've actually appreciated their opportunities as a female more so in the Army than in the civilian world. And just in general, for both men and women, probably the best little gem of being in Army medicine is the incredible opportunities to do different jobs. And you heard my bio, so you heard a lot of the different positions that I've been in. I would categorize it more generally that if you want to do research, you can do research. If you want to do clinical medicine, whatever specialty that is, you can do clinical medicine, because we have every single specialty that there is in Army medicine in our GME programs, and we have almost every single fellowship, and we encourage those. If you want to be in academic medicine, then you can be teaching and do academic medicine. And this picture is an example of one of our graduating residency classes last June, where I was the department chair, and just how proud I was. I saw several different classes go through as I was teaching in academic medicine as part of my career. And if you want to do leadership, you can be in leadership. And I've got a chance to be a clinic director and department chief, and we've got Army leaders who run hospitals and even surgeon generals of the Army. So you have a lot of different tracks that you can do and a lot of different jobs that you can do. And when you finish your career, whether that be a 4-year commitment from an HPSP scholarship or more like myself, a 20 or plus year career, you have broadened your skill sets and developed a resume that is beyond your years. And so at a very young age, you have led you have done a lot of different things, and you've had an opportunity to really make yourself be used in any area of medicine that you'd like to be. And then there's a couple other things that I like to talk about that just get into why I really enjoy Army medicine and the things that it has kept me kind of fresh in medicine, because I think there is a burnout factor in medicine that I see in my 40 to 50-year-old colleagues after just kind of 20 years of going through the grind of seeing patients, where they start to feel a little compassion fatigue, and it becomes difficult. What the Army has given me a chance to do is some humanitarian missions, or even deployments that I've talked about, where a little bit break from that monotony and a chance to do something kind of exciting and different. And these slides are an example of that. The one on the left is a picture of me and one of the residents, one of my family medicine residents in Indonesia. The one on the upper right is me, and well, not me, but the family medicine resident sitting there is back in 2010 we went to Thailand, and that was two different humanitarian missions. We went for about 3 weeks. We were able to share didactics. We were able to see their underserved population, see disease processes we'd never seen in America. Basically develop relationships with those countries, and the Army has used us to do nation building. As physicians in the Army, we got a chance to go over and see their culture, develop relationships, and do some nation building between our countries, so that in the future, as we deal with these countries, we've developed nations, and hopefully, or we've developed relationships to keep us from potentially from conflict and more be able to work things out. And that bottom right pictures of me in Iraq when I deployed in 2003. One of my first showers, and although that doesn't sound like a lot of fun after spending a couple months in a desert taking care of soldiers, I look back on it. It was one of the hardest and most difficult yet most rewarding things I've ever done. And taking care of soldiers who did that, and then were also out fighting, and I got a chance to take care of them. I look at that as just not something that you want to have to do, but something that you certainly are very, very proud to be able to do, and look at it as a very rewarding experience. And also look at it as and again, a mini sabbatical from the grind of typical medicine to be able to do something different. Can you have a family in the military? I've been married for almost 20 years this summer. I've got 3 kids, almost one boy 15 and girls that are 12 and 8, and we've had a great experience in the Army. We've loved everything we've done. It's been a wonderful position. Now, I've been stationed in Hawaii twice, which is certainly adds to why it's been so great. And you can see that picture on the left. That's my family in Hawaii when I got back from Afghanistan. Of course, that could be any time in Hawaii that you could be enjoying that. And I think that's certainly part of it. We've taken advantage of some great opportunities in the Army. The upper right picture is us in China. I was in Korea. My family came over, stayed with me, and then we took a 4-day weekend and went to China. My kids got to climb at age 5 and 3 years old. They're climbing the Great Wall of China. So some pretty neat experiences that our family's gotten to do, and I think we've really enjoyed and embraced the opportunities. And then that bottom right picture is just the family that I developed in Afghanistan. That's those. I did everything with those men and women, and those are your family. And then my family at home was being taken care of by their families and others. And so the Army is a family within a family. I think that's important too, and why we enjoy what we do so much, because of the people we get to do it with. And then I throw this slide in there just because adventure is something that some people say, I want to be in the Army, I want to be adventurous, and I want to do something different. And you do have that opportunity. You don't have to do that as a physician, but you do have opportunities to do that as a physician. The slides on the right, those are me, though I always joke around, that's not a stunt double. Those are me in the back of that helicopter, or sitting off the back of that helicopter as well in the lower right. And I was a flight surgeon, take care of aviators, and those are some missions that I got to fly on. And then the picture on the left is me surfing in Hawaii. I know that wave looks small, but that's a camera issue. It's really much bigger than that, and very exciting and adventurous. But all to say that those things are out there. I have jumped out of airplanes. I've rappelled out of helicopters, and you can do those things and have a chance to do a little bit something different than just medicine, which can make it fun. But you don't have to. Most physicians don't do that if they don't want to. But those are things you can seek out if you'd like to. I'll leave you with this slide, and I call it elite because I look at the American flag and it does something to me. It makes me very proud to be able to do what I do. I don't consider us elitist. I just consider us an elite team that gives the very, very best health care to the very, very best men and women who serve. And so I challenge those out there that if any of this kind of tugs at you and says, I'm really interested in that, then you're the kind of person that needs to consider the HPSB scholarship, because I don't feel it's for everybody, but I do feel it's for those who are called, who really want to challenge themselves. And I'll say it again, the Army needs physicians, but we need physician leaders. We need leaders who are willing to do difficult, hard, yet rewarding and challenging jobs. And we need physicians who are resilient, to be able to do things in multiple different environments, multiple different places, whether it's a teaching facility, a community hospital, a small clinic, or a deployed environment. And you know, for the 90% of your career, you're going to be, as Sergeant Major said, you're going to be a doctor and you're going to take care of patients, and it could look the same in the civilian world as it would in the Army. But that small percent, the Army is going to ask you to serve, and maybe even heroically serve our men and women, and do it in a combat environment. And you know, for me, I've spent 17 years as a physician, and I've spent two six-month tours doing that. Hopefully, we won't have to continue to do that, but if it's needed, that's what we're there for. And then when we're not there, we're providing that great care back in our military hospitals in the United States. And so I will turn it back over to Sergeant Major and let him talk to you about what the actual scholarship entails. Hopefully, you know, some of my story and some of the things that I think are important. And it's not just me; it's many physicians that serve in different specialties that I work with. Will say that if this excites you, then this scholarship is definitely for you, and I think it would be a perfect fit.
That's great, sir. Thanks for passing it off. And I'll tell you, I'm sure all y'all logged on here tonight, not to necessarily hear about the Army or to hear about Dr. Husted's story, but to hear about our scholarship. And we intentionally talk about what it means to be a soldier, what type of men and women do serve in the military, and we talk about Dr. Husted's personal experience before we talk about the scholarship intentionally. The scholarship is incredible. Who would not take advantage of an opportunity to pay for med school, receive a $2,100 a month stipend while you're in med school, and we currently have a $20,000 cash bonus that we throw on top of this incredible scholarship. Who would not take advantage of that? And we do find that many of our applicants don't necessarily know what it means to serve in the military, and are sometimes only looking for an opportunity to pay for medical school. And if that's you, certainly consider what Dr. Husted has said. If you do feel called, if you do feel that call to serve, whether it's to serve your nation or to serve a soldier, then we can talk in more detail about the scholarship. And it says on the screen what we cover. The beauty of the Army Healthcare Profession Scholarship Program is that if you apply and you are selected for the scholarship, your medical school experience is identical to every other man or woman who's going to medical school across the United States. So whatever medical school you're accepted to, I'll use Johns Hopkins as an example again, simply because we were there today. There's students who are attending Johns Hopkins School of Medicine, and the Army is paying for their med school. Again, they're attending the same classes. Everything is the same. School's paid for. They're also receiving a $2,100 a month stipend while they're in school. One added opportunity that they have is they have the opportunity to attend officer leadership course, which will prepare them for that officership, for that service as a professional military officer. They also, between their second and third, and then third and fourth year, have the opportunity to do rotations at Army Hospital, month-long rotations at an Army hospital. Not only is it a great opportunity to interview, essentially, for the residency training program that you might end up applying for, but also you receive active duty pay. Very few of your peers in med school will be receiving active duty or receiving any pay while they're doing their rotations. And again, I kind of covered this slide in the last 5 minutes, but if someone is a fourth-year med student or in a post-bac program is competing for med school next year, or if, again, the process is the exact same, and we actually recommend that you apply for our scholarship in tandem with applying for medical school. If you meet our criteria, and just to highlight what that criteria is, minimum acceptance criteria is a 24 on the MCAT and a 3.2 GPA. But what we've found just from last fiscal year's analysis of the applicants that we had, average selection criteria is going to be a 30 on the MCAT and a 3.64 GPA. So again, it is a very competitive scholarship, and we recommend that you do that in unison with applying for your med school. So if you meet the criteria, if you are selected and then subsequently selected for medical school, you start med school, complete your 4 years. At the completion of those 4 years, you will compete in a military match and attend an Army residency. Our residencies are at those 8 teaching hospitals nationwide. We have some of the top-ranked residency training programs in the United States, and many of our programs are the top program in the United States for their field. All of our residency programs are ACGME accredited. One thing unique about attending a military residency is that you're paid active duty pay as a captain. I use DC a lot as an example of a resident at Johns Hopkins makes maybe $42,000 to $44,000 a year, whereas an Army resident at Walter Reed, which is in DC, is going to make somewhere between $70,000 to $80,000 a year. So again, you complete med school, we've paid for your med school, you receive a stipend while you're in school plus a bonus, you've attended an Army residency, received the same residency training as a peer who went to a civilian residency, and now you have a service obligation. So we're not just going to pay for your med school and give you this great training and let you be on your way. There is a minimum 4-year service obligation. Some of the service obligations vary based on your residency. I'll use general surgery as an example. General surgical residency is 5 years long. Your service obligation would be 5 years to the Army. So our average service obligation is 4 years. At the end of that 4 years, you simply make a decision. Do I want to stay in the Army, or is this the way I'd like to live out my medical career, or would I like to go to civilian medicine? If you choose to take that path to civilian medicine, you, again, have paid for med school, you have the same training as your peers, and you have 4 years of excellent hands-on experience, and certainly your CV would stack up next to any of your peers that you graduated medical school with. If you decide to stay in the Army, there's countless opportunities, financial incentives that are offered, as well as fellowship opportunities, and often we get questions about fellowships. The Army does have almost any fellowship that you could find in GME, we have in the Army, and if we don't offer the fellowship, then certainly physicians can compete in the civilian match and attend a fellowship at a civilian hospital. We offer the fellowships as an incentive. It makes our docs better, and we get another year or two out of you if you commit to one of those fellowship training programs. We talk about the qualifications, and you do need to be a U.S. citizen and cannot hold dual citizenship. We talked about being enrolled or processing for medical school. And you do have to maintain full-time student status and meet our moral and physical qualifications. If there's any questions about those are generally better suited for a one-on-one conversation with a recruiter. And following this presentation, we can discuss how to go about that. So before we open this up to questions, we like to just give you a minute to read the 4 questions on the screen. Lee, I appreciate the time this evening, and we'll leave this open for any questions.
Okay, I think we're going to have Christy take over and manage the questions here. We have, let me see if I can get her. Yeah, it looks like she's having some issues with the audio, so I will go ahead and manage the questions. Oh, yes, now I can hear you.
Can you hear me? Wonderful.
Yeah.
Okay. Well, thank you guys so much for your presentation. We have some great questions coming in, and all of you listening, if you have questions, you can continue to submit those, and we will go through them for as long as we have time. Our first question is, do Army doctors ever see combat?
Yeah, this is Dr. Husted. So yes, I would say the answer is definitely yes. But let me tailor that. The Army doctors are deployed. For instance, I've been in Iraq and Afghanistan, but you are not deployed as a combatant, meaning you're not asked to fight. You are asked to be a physician. So over the past 12 years of the war, I would say pretty much every physician that's been in for that entire time has been deployed at some point. And what they've done is they've worked in hospitals, or they've worked in surgical teams, or they've worked in aid stations where they've taken care of patients. Most physicians will be placed in an operating base, which is secured, and the soldiers will go outside that operating base and they'll fight, and then they'll come back inside that secured operating base where you will be to be cared for. And if you're a primary care physician, you're probably doing primary care type stuff there. If you're a surgeon, you're doing surgical stuff and taking care of trauma. And so the answer is yes, but you're doing it as a physician in as a secure environment as possible. Is there still dangers? Yes, but the Army has invested a lot in you as a physician and wants you to be a physician and be safe. So hopefully that answers the question of what you were getting at.
Great, thank you. All right, this next one says, I'm a permanent resident of the U.S. for almost 2 years now. By the time I become a citizen, I will be beginning my 3rd year of medical school if everything goes according to my plan to matriculate in 2015. My dilemma right now is whether I should join the Army Reserve to earn citizenship earlier or to wait until my 3rd year of medical school to earn the citizenship. I very much want to practice and learn the experience of serving as an Army doctor, at least for a few years. What is the best route for me to pursue?
So, Christy, this is Sergeant Major Murphy. That might be better suited for a one-on-one conversation, to be quite honest. There is currently a program for non-citizens and for green card holders to receive an expedited path to citizenship through military service. It sounds like the person asking this question, pardon me, does have a I-551 card, and they are correct. They could join the reserves and process for naturalization and subsequently serve as an Army physician. But I think at the end we could probably just follow up with it with an email address.
Yeah, and we will have that contact info, so we could get that contact info to you to pursue that more specific question, if that would be a better route.
Great. Absolutely. Hate to not trying to dodge the question. It's certainly one that's we have to talk about what an individual's goals are. There's many variables to that question. So
sure. Oh, no problem. We'll put you in contact with them later, and they can get their questions answered. But we
Great.
have plenty more.
Thank you.
This next person asks, do you have a say in where you are deployed, or are you just sent somewhere?
This is Dr. Husted. So you really don't have a say. There'll be a deployment order, and they'll say, hey, we need you to go here. It's not really up to you where you go necessarily. There are times where you can kind of pick where you're potentially for deployment. For the most part, where you go is going to be up to what the need of the Army is for deployment. Really, there's so little times that you're going to be deployed in your career. Most of the time, you're going to be working in an Army hospital in America. And in that case, you do have a say. So in those kind of things, where you work at, and what kind of job you do, the kind of and the place, the location that you do it in, you'll work with somebody. You work with your consultant, who's a physician in your specialty, to get you to those types of jobs. And that's not just wherever you need it. The Army's going to stick you. They try to get the right person in the right place at the right time. And that's some way where you can have some control and take some control and be proactive in your career. Deployments is less so, though.
Christy, this is Sergeant Major Murphy. Sometimes the word deployed, so in the Army, a deployment is when you're called for 6, 8, 9 months to go to either a combat situation or on a humanitarian mission. But again, those are just a very small percentage of what an Army physician does throughout their career. And like Dr. Husted says, the various positions that he's held, the various jobs that he's held, we would not call those deployments. And in those jobs, absolutely, he would work with his career manager and determine whether it was overseas or in the States, determine the best fit for him, both personally and professionally.
Yeah. Yeah, and as Dr. Hughes said, and all the jobs that I've been in that you saw in my bio or that I talked about are all ones that I pursued and I were my first choice of where I wanted to go. So I think hopefully that answers the question appropriately.
Yeah, thank you for that clarification. I think that helps quite a bit. Our next question, the student says, I am an emergency medicine physician assistant who will be beginning medical school in July of 2014. I originally wanted to obtain the Army HPSP scholarship, however my MCAT score was low. I will be attending LACOM in Erie, Pennsylvania for a 3-year accelerated medical school for PAs. Is there any way that I could obtain the HPSP with my low MCAT score? I have an excellent GPA and resume, and LACOM no longer requires an MCAT for certified PAs.
So, Christy, this is Sergeant Major Murphy. We, on case-by-case basis, we do consider exceptions to our MCAT criteria. Again, the minimum acceptance is a 24. If this student has less than the 24, then there would have to be, it's a 24, and then Dr. Husted just reminded me that it's 8 in each of the graded categories. So if this student does not meet that mark, 24, and then 8 in each of the graded categories, then we can request an exception or a waiver, but generally there has to be some extenuating circumstances, maybe some unique skill sets, and it sounds like this emergency medicine PA might have that, but certainly it's with the competitiveness of this scholarship and the I talked earlier about our average of selectees last year being 30 on the MCAT. It can be tough to get those exceptions, and again, that might be a conversation better suited for.
Right, and as Dr. Hughes said, I just recommend they work with one of the RA Med recruiters who can submit for these waivers, and after they submit for a waiver, then they would go through the board process, and it's certainly reasonable to submit for it, particularly with their background. So it's not guaranteed, but they can at least ask for it.
Okay. Thanks, and we'll have, again, that contact info afterwards if there's any follow-up for that one. This next student asks, are Air Force doctors deployed to Afghanistan the same way, or is that just the Army?
The Air Force, yeah, this Dr. Hughes said, so I worked with Air Force and Navy physicians, and they're deployed the same way. They may be deployed in different areas. They may be in a boat. They may be in a different location. But they do deploy, and it's just a different type of environment that they may be working in. And so if that's something that they're interested in, I would certainly recommend they talk with the Air Force and the Navy physician about, hey, what was their deployment experience like as well. But we all deploy just different environments depending on what service you're in.
Okay, thanks. Our next student asks, does this apply to occupational therapists and rehab people such as PTs as well, or is it only for physicians? I'm a master's student in occupational therapy.
So we do have opportunities for all healthcare professionals. The scholarship program that we're discussing today is specific to med school and dental school as well, actually, and veterinarian. But we do have programs for occupational therapists, for physical therapists. I'm familiar of a program where it's a doctorate in occupational therapy, and I would just recommend that student email myself. You'll have the contact information at the end of this, and we have recruiters who only recruit occupational therapists and physical therapists. So do we need them in the Army? Absolutely. We have some of the top-notch rehab facilities in the United States. And actually, I would recommend Googling Center for the Intrepid in San Antonio. on YouTube, there's some incredible videos of a rehab program that the Army, a rehab facility the Army has built there, and we do have similar programs. It's not necessarily the exact same scholarship program.
Okay, thanks. Here, this incorporates several people's questions. One big question has been whether people will get to train and practice in their chosen specialty. Do you have any data about the percentage of people who have to do a GMO tour or operational tour after residency?
Yeah, this is Dr. Husted. That's a great question, one we get every single time, and the answer is you get to train in whatever specialty you decide to train in. So the Army will not force you to train in a certain specialty, and we have all of them. You pick which one you want, and you compete for it. So it's very similar to a civilian match. So you will compete in an Army match that you rank order what specialty you want and the location that you want to do it. Usually someone picks one specialty and then picks all the different locations in whatever order they want to go to those locations. You do rotations with them, you interview with them, you have a packet with them, they rank order you, and then it goes into a match process. If you don't get picked up for the specialty that you would want to do, the Army will offer you other specialties that maybe didn't fill. If you do not want those, then you can go into a transitional internship year, be trained on a kind of a broad spectrum of different things, and during your transitional year, you can also apply again for whatever specialty you wanted to go. Let's say you wanted to do general surgery, but you didn't get picked up. You don't want to do, you were qualified to be maybe family medicine, but they offered it to you, but you didn't want that, so you decide, no, I'm going to do a transitional year and apply for general surgery again. You can do that. And if you don't get picked up for general surgery again, you can go do a general medical officer tour. And that's just basically being a general medical officer who has done an internship, been licensed, but has not done a specialty or been board certified. You take care of, you do that position, and that can enhance your packet to, again, apply for a general surgery residency or whatever you want, again, and maybe you're a little bit more competitive now. The Army doesn't use GMOs specifically. All of our residencies are categorical for the most part, meaning you apply for whatever residency you want, you're going to start and go through the entire training and not go out and be a GMO. We used to do that back in the 90s and before that, but since the 2000s, almost the vast majority of residencies are categorical, meaning you'll continue all the way through. So we have very few GMOs out there, except in the situation that I explained, and that's because the Army does let you choose what you want to do. Did I get all aspects of the question?
Yeah, I think that was great.
Okay.
Thank you. The next question here is there a path for a foreign medical graduate citizen, U.S. citizen, who is interested in practicing in the Army to join and or pursue residency in the Army?
So the answer to the question is yes, there is a path. The challenge is the residency, and we often have foreign medical, American-born foreign medical graduates who ask about applying to our residency training programs. And that's very, very uncommon that a civilian would attend one of our residency training programs. Our training programs are reserved for our HPSP recipients, and there's also a military medical school. So there's 350 Army physicians graduating med school each year. That's who we use to fill our residency vacancies. If that foreign medical graduate was in an American residency, then absolutely they could apply for various programs we have for physicians who have already completed school and are in residency training programs. We have loan repayment and stipends for residents as well, but certainly the first hurdle to overcome would be acceptance to an American residency.
Sure. Okay, thank you. Here's another one. This one is a little long, but I think it's a worthwhile question. On the student doctor forums, there tends to be large amounts of people who argue vehemently against Army and military medicine. They note a lot of reasons such as bureaucracy of the military, losing skills as a physician due to low patient volume, diversity, becoming more of a desk worker than a doctor as you rank up, and more. I'm here because I'm definitely interested in military medicine, and I certainly feel the call to serve, but having no history in the military, some of these concerns give me pause. Could you address some of these concerns and perhaps why some of these people end up unhappy in military medicine?
Yeah, that's a great question. I think, some of the concerns are valid, and I think that's why it's important to understand what your career can entail and being proactive in your career. I have definitely seen physicians who have been disgruntled or frustrated by not doing exactly what they wanted to do, and I think the importance of taking a scholarship like this, and if you're interested in it, is to understand that you have a lot of opportunities out there, and it's very important to be proactive in saying this is what I would like to do, and this is the path that I would like to go down, and working with the consultant and the human resources to be able to get to that path. And the better you do, it's very similar to medical school. You do well or undergrad. You do well in undergrad, you get into the medical school of your choice. You do well in medical school, you'll likely get into the residency of your choice. You do well in your residency, you're likely to get the jobs and the things you want to do. You do well in your jobs, and you have a positive attitude, and you give 100%, and you do well, you're probably going to get the jobs that you want to do. And it's not too much different in the Army. And the thing is, there's lots of paths that you can take, and so that as far as whether I think I talked about it, whether you do just a leadership path, and that's some of the people that talk about you rank up in the Army and you have to do leadership and things. Yes, you will be asked to lead, and when you're asked to lead, you'll have less clinical medicine. Now, not everybody has to do that, but that can happen, and that's why I say it's important that the Army is the right fit for you, because it needs to be for someone who wants to be more than just a physician, but wants to be a physician leader and a physician officer who wants to be challenged. For instance, I was teaching residents, and I was in a clinical job, and I was loving it, and they asked me to be the clinical director for the clinic as well. And very difficult job, but gave me some great skills. Took me a little bit out of clinical medicine, but made me be a leader and made me do some hospital business administration type things, and was actually a great skill set for me to learn. Maybe not my first choice, but turns out to be if I had to do over it, I certainly would. And so some of those things really depend on your attitude and the way you pursue your career. So, I know some physicians, as they've ranked up, they have stayed in clinical medicine because that's the way they've pursued it, or they've stayed in research because they've pursued a research track. Some want to do leadership and have pursued that leadership track, or some want to do operational. And this gets to the question of, do I get to use my whole skills, or do I degrade my skills because I get into a position that doesn't allow me to do all the things that I want to do? So those who go into operational, they may actually want to decrease their skill set and just focus on what it means to be an operational kind of combat physician. And some people get into those slots and they have to do them, and they get frustrated. So I tend to say, hey, the people that are attracted to the military need to be resilient, be able to adapt, do some of these difficult jobs, do them well, maybe do them for a short period of time, and then get back into clinical medicine. Another example of that is my first job was an operational job where I was taking care of soldiers, 18 to 40-some-year-old, mostly healthy, but I'm a family physician who does womb to tomb. I deliver babies, I take care of geriatrics, and I take care of kids, and I do a lot of procedures. So when I was in that first job, I went over to the hospital. And there's always a hospital or clinic around our bases or our posts, and I took OB call, and I took inpatient call, and I did peds clinic, and I did those things to keep my skill set up so that when I finished that job, I could go teach medicine at an academic institution and be able to train family medicine residents in the full scope. So those concerns are valid, but I think there's ways to circumvent that based on how you are, how proactive you are in your career, and the attitude that you take.
Christy, one other thing I'd like to highlight on that, and that's a great question and actually very well stated. Appreciate you reading it verbatim. But so we interact with a lot of health hospitals and physicians in private practice and physicians who are in a hospital setting, and many of them would voice the exact same complaints that you just brought up in terms of bureaucracy, in terms of, especially for those in private practice, in terms of paperwork overload and the challenges of running a practice. Again, not to say that doesn't happen in the Army. It does. It happens many places in medicine. I would say the Army is cutting edge in terms of guiding healthcare policy, certainly for our military, which could potentially guide healthcare policy for the country. So certainly there's a broader approach to medicine and the practice of medicine in the Army. Another thing that I'd like to highlight is that Army physicians don't have the challenges of dealing with insurance companies or ensuring an insurance company supports whatever procedure or labs that they need run. An Army physician is not a revenue generator for a hospital. An Army physician is simply there to take care of these great men and women who serve. Hope we covered everything in that answer.
Yeah, no, that was great. Thank you. This, depending on time, may be our last question. This person says, I'm not sure I understand the payback period. My understanding is that for 1 year of medical school, you owe 1 year of active duty. Does residency count towards that? How does that work? Can you address that some more?
Great question. So no, residency does not count toward that. You are active duty. You do receive an income, and it does go toward your pension plan, but that does not count as your payback period. So the student is correct. If a residency is 4 years or less. So 4 years of med school, the service obligation following residency will be 4 years. The only time that changes is if the residency training program is greater than 4 years. So I used general surgery earlier as an example. So someone who wanted to be a surgeon would go to 4 years of med school. They would go to a 5-year surgical residency, and then they would incur a 5-year service obligation. Was that clear?
Yeah, I think that was great. Thanks. Here's
yeah, this is Dr. Houston. It's either going to be 4 years or the length of the program, to make it simple. So the minimum 4 or the length of the program if it happens to be more than 4. Because you're incurring a commitment for each year you're in residency, even if you technically are serving your time during residency from HPSB. The more important kind of thing is either 4 or longer based on the length of the program.
Okay, great. Yeah, that I think cleared everything up. All right, here's actually 2, but I'll combine them. At what point do scholarship recipients attend basic training, and does physical fitness competency play a role in your potential acceptance for the scholarship?
Great question. So the first one is easy. Generally, if possible, we like to send them to, it's not necessarily basic, well, it's not basic training, it's basic officer leadership course. So we don't need we don't need future physicians to learn how to be expert marksmen or read a compass or lead a team into combat. We just need them to know the basic skills necessary as a physician, and more importantly as a physician leader. But basic officer leadership course, we try to send future physicians before they even start medical school. If that is not possible, then generally we send them between their first and second year of med school. And the second question, if you could refresh my memory, Christy, I'm sorry.
Oh, sure. Does physical fitness competency play a role in your evaluation of scholarship applicants?
So physical fitness competency does not. There is a physical examination, but what this physical examination is going to determine is just we do have certain height and weight criteria. It's just to be blunt, it's kind of a sports physical on steroids. It's just a in-depth examination. So we're not going to expect someone to be able to do push-ups and sit-ups and just to join, just to qualify for the scholarship. But certainly before you attend your basic officer leadership course or any of those away rotations at an Army hospital, you need to be prepared to do a Army physical fitness test, which is 2 minutes of push-ups, 2 minutes of sit-ups, and a 2-mile run. And the requirements, the minimum requirements for those vary on age and sex. And again, we could go into those in detail. But those are not prerequisites for applying for the scholarship.
This is Dr. Houston. Yeah, the physical exam is more geared towards, do you have a medical condition that would preclude you from serving? For instance, you have type 1 diabetes. That would probably be a non-starter. You would not. That'd be probably not something that could be waived. There are some things that people have to become medical conditions they have that are don't meet requirements but could be waived. But that's something we can get into on an individual basis.
Great. Dr. Husted and Sergeant Major Murphy, thank you so much for your presentation and for answering all of our questions tonight. We still have a lot of questions that we didn't get through, but we have contact info for all those individuals, so we will give those to you so you can follow up as you're able. Everyone listening, thanks for joining us tonight. We will at some point have a recording of this up on our YouTube page as well, so stay tuned for that if you want to hear anything more or share with your friends. And I think that will wrap things up for us this evening. Have a great evening.
Thank you.